Worried about your drinking? Reserve your place on today's free Quit Drinking webinar and get a copy of my best-selling book, Alcohol Lied to Me, as a gift just for turning up. www.stopdrinkingexpert.com. Hello, Sober Army. How are you? This is Craig Beck, aka the Stop Drinking Expert and the author of Alcohol Lied to Me, a best-selling book that has helped hundreds of thousands of people to quit drinking. And if you want a free copy, go to the website and you can get one. All right, today we are going to dig into a very interesting email from Mike, and he wants to talk more about this urban legend, this myth that drinkers talk about all the time, that drinking in moderation is better for you than abstinence. And in fact, if you press them on it, because they'll have done their research, if you press them on it, they'll even be able to quote studies that suggest that they found that people who drink in moderation live longer than the people who don't drink at all. What the hell? So what's going on there? Well, if you've been watching or listening to the Happy Sober podcast for a while, you will know that I've debunked this many times. Mike will reference that in his email. The reason that result has come out in so many studies over the years is the data was fundamentally flawed. And if you put garbage in, you get garbage out. The problem with the research that suggests that drinking in moderation is better for you than abstinence is they didn't qualify the cohort that said they didn't drink. When someone in the research study said, I don't drink at all, they didn't say why. They just went, okay, don't drink at all. Now, a lot of these people that don't drink at all would love to drink. Given the opportunity, they would be desperate to drink. But unfortunately, they've been drinking so heavily and for so long that a doctor has sat them down and said, if you drink another drink, you're going to die. You have cirrhosis. You have end-stage liver failure. If you drink, you are going to be dead within a few months. And so they would love to drink, but they can't. And when you have people who are that poorly, that ill as a result of their drinking, and if you have cirrhosis, if you have end-stage liver failure, you have about 6 months left to live. And you're not going to get a transplant because they don't give transplants to alcoholics. These people who were in the study and reported abstinence and dropped down dead 6 months later heavily skew the results. And what you end up with is data that suggests that abstinence is worse for you than moderation. It's complete garbage, but it's being used by drinkers and the alcohol industry as evidence for the benefits of alcohol for decades. So this is where Mike's email comes in. And thank you, Mike. This is a great email, and we're going to dig into it. I'm going to put my glasses on because I'm 50. So Mike says, hi, I'm hoping you can address this on your show or otherwise. I understand the legendary study that concluded that those who drink moderate amounts of alcohol live longer than those who don't drink at all was debunked because it counted ex-drinkers as non-drinkers. Yet this raises two more questions. One, is there a definitive study that corrects this flaw and gives us an apples to apples comparison? Two, if former drinkers who no longer drink have worse outcomes than drinkers, then does this not provide a pessimistic outlook for those who quit or who want to quit? What a great email. Let's start with number two. So what Mike is saying here is if we understand the research correctly and the data correctly, the cohort in the abstinence sector involved a lot of people who had quit drinking, having formerly had a problem, and they still had a higher mortality rate. So Mike is saying, if you quit drinking, it sounds like there's no benefit because you're still going to have a higher mortality rate. You're still going to die as a result of your drinking over the years. So what's the point of quitting if you've already done the damage? Yeah. And that's kind of right, but not really, because that really only applies to people who've done irreversible damage. You know, if you've got cirrhosis of the liver, if 50% of your liver is now scarred and beyond repair, then yes, you have a higher mortality rate. The chances are you might live 5 years, you might live 2, you might live 2 weeks, but you're not going to live your true lifespan because of the damage you've done. That's correct. But thankfully, the vast majority of people that come to me, because I specialize in dealing with problem drinkers and not full-blown alcoholics, because I'm not a doctor, I can't give medical advice or supervision. The vast majority of people who come to me have done a lot of damage to their health, to their families, to their loved ones, but most of it is reversible. They might have elevated liver enzymes, for example, but perhaps they don't have scarring of the liver yet. They might have put a lot of weight on because of their drinking. They maybe have other, health issues as a result of their drinking, but most of it is reversible with abstinence. And those people will go on to live much longer lives than they would have done if they'd carried on drinking. All right. So that's point number 2. So let's move to point number 1, where Mike is asking for conclusive research definitive study, as he says, to correct the flaw that abstinence is worse for you than moderate drinking. So let me get rid of Mike's email. Thank you for that, Mike. And I'm going to bring up another screen here. And I'm not going to give you definitive study, Mike. I'm going to give you 3 definitive studies. And we're not going to go into Reddit pages or red tops or trashy, tabloid newspapers. We're digging into the scholarly articles on Google. We're going into the formal medical research here to answer and address your question. First one is a study done by the United States government. And what this is, it's not a new study, Mike. This is a reevaluation of, I think it's something like 90 previous alcohol studies that concluded that drinking in moderation is better for you than abstinence. It's a reevaluation. The title of the study, Do Moderate Drinkers Have Reduced Mortality Risk? A Systemic Review and Meta-Analysis of Alcohol Consumption and All-Cause Mortality. What a sexy, catchy headline these scientists do come up with. So we're not going to go into the objectives and the methods and all that, but let's just jump into the results and the conclusions of this report. So basically here it is saying, without adjusting for the bad data, pretty much 87 studies concluded that drinking in moderation is better for you than abstinence. If you filter out the bad data, people with heart disease, people who've been told to stop drinking for liver failure, things like that, you get a very different outcome. And the conclusion of this reevaluation is this: estimates of mortality risk from alcohol are significantly altered by study design and characteristics. Meta-analyses adjusting for these factors find that low-volume alcohol consumption has no net mortality benefit compared with lifetime abstinence or occasional drinking. These findings have implications for public policy and the formulation of low-risk drinking guidelines and future research on alcohol and health. And what that final bit means is all governments around the world publish a safe drinking guideline. In the UK, for example, it's 21 units per week for men, and I think it's 14 units per week for women. And basically what that means is they're saying, drink up to that point and you're safe. What this reevaluation of the data is suggesting is that's not true. And governments need to rethink their alcohol policy. So that's study number 1. Study number 2 is from the American Journal of Medicine. And this is, what is the date on this one? February 2016. And the conclusion and the headline is moderate alcohol consumption is not associated with reduced all-cause mortality. Again, we won't go into the methods. We'll just jump into the results. This is a study of 207,000 person years, which is a strange way of putting it, but basically says it's a robust study and it follows nearly 8,000 deaths. Okay. So what did it conclude? The conclusion is moderate alcohol consumption is not associated with reduced all-cause mortality in older adults. The previously observed association may have been due to residual confounding, which is a fancy way of saying bad data. But the final bit of research I'm going to share with you, Mike, is the one I like the most. And I've quoted this a few times before. I believe this was done by Cambridge University in the United Kingdom. It was published in the Lancet, the medical journal, also from the United Kingdom. The title of the research is Risk Threshold for Alcohol Consumption, Combined Analyses of Individual Participant Data for 599,912 current drinkers in 83 prospective studies. Oh, sexy title. So again, we won't go into all of the data on this because it is quite extensive. But basically, the reason I like this research so much is it's a study of 600,000 people. Not just 600,000 people, but 600,000 drinkers, and something like 40,000 deaths. So this is the gold standard of research, if you ask me. We'll come back to this point I highlighted there. Let's just scroll down here to the implications of this research, all right? The chief implication of this study for public policy is to support reductions of alcohol consumption limits in existing guidelines, suggesting that the threshold for lowest risk for all-cause mortality is about 100 grams of alcohol per week, which is about 5 to 6 units in the UK. Remember, I told you at the moment, the current government guideline is 21 units per week is safe. This research is saying 5 to 6 units, and it's not saying that's safe. The chief implication for scientific understanding is the strengthening of evidence that the association between alcohol consumption and total cardiovascular disease risk is actually comprised of several distinct and opposite dose-respondent curves rather than a single J-shaped association. Blah, 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 blah. Scientific jargon. The wording is what's really important here. The lowest risk for all-cause mortality is 100 grams per week. It means even if you only have 5 glasses of wine a week, you are still taking a risk, but that's the lowest risk that they can come up with. The other finding up here, alcohol consumption was roughly linearly associated with a higher risk of stroke. It goes on to say the same thing here about heart attack and hypertensive disease. The risk is linear. So what that actually means is if you want the risk to be 0, you have to drink 0. If you drink 1 drink, then because it's linear, it goes up 1 and carries on. And they even state here that people drinking over 100 grams a week, those who are drinking between 100 and 200 grams a week, between 200 and 350 grams a week, have a lower life expectancy at the age of 40 by approximately 6 months, 1 to 2 years for that 200 to 350 gram, or 5 years if you're drinking over 350 grams per week. So to summarize all that, there is no safe amount of alcohol. The only safe amount of alcohol from all of that research, from hundreds of thousands of people, from tens of thousands of deaths, the only safe amount of alcohol is 0. So thank you, Mike. That was a great email. I hope that helps. Let me know in the comments what you think. And if you've seen any of the research that backs that up or argues against it, I'd love to see it. If you have questions, if you want me to dig into any other subject, if you're struggling in any way, email me, craig@craigback.com. Visit the website, Stop Drinking Expert, and I will see you in the next episode of the Happy Sober Podcast. Thanks a lot. See you soon. Worried about your drinking? Reserve your place on today's free Quit Drinking webinar and get a copy of my best-selling book, Alcohol Lied to Me, as a gift just for turning up. www.stopdrinkingexpert.com